An update now to the 92-year-old blind woman we told you about yesterday who was about to be discharged from hospital amid family fears she had nowhere to go. We have good news to share, but this story highlights the critical lack of long-term care beds in this province. We have the latest numbers of how many are actually available, and there are not many. But first, the resolution.
What is the hospital now saying is the best care for your mother?
The long-term care homes.
Long-term care.
Yeah.
Do you feel like this is a victory?
Yes. I'm happy about it.
Just yesterday, Yvonne Crossman was worried her mother, who needs 24-hour care after major surgery, was going to have to move back home alone or into an expensive retirement home after the hospital told her she was ready for discharge. She says they initially told her her mother had to be out last Saturday.
She's just learning how to walk. But she needs to use a walker. You know, she's learning to sit up, and she's trying.
After a meeting with the hospital this morning, Crossman says she's now being told her mother will be moved into transitional care until a long-term care bed can be found, which is what they wanted. But they have to take the first room that is offered.
If you don't take the first available long-term care bed that the hospital finds for you, if you don't like it, what
Yes.
did the hospital say will happen?
It's $1,200 a day.
In a bid to free up much-needed hospital beds, the Ford government passed new legislation last week that allows health officials to move patients ready for discharge into available long-term care homes, even if they don't want that one or if it is away from their communities. If they refuse, critics say hospitals could charge patients the daily uninsured rate, which can be as high as $1,800 a day.
Technically, you're not going to be able to choose where your mother ends up. She will be given the first available spot. Are you comfortable with that, Yvonne?
I don't know yet, but we will see.
Finding an available home is not an easy task. The Ministry of Long-Term Care shared the most recent data with CityNews. Out of the 79,000 long-term care beds in Ontario, only 2.9% are vacant. That's just 2,270 beds. The wait list for long-term care is now 37,000. 1,080 of the available beds are for profit, 682 are nonprofit, and 508 are municipal. Yvonne's mother has been on a wait list for long-term care for just over a year.
I thought it would be a lot easier as she aged. The transition would have been a lot easier.
It's not. Home care is also under strain. In the last 4 years, the wait list has tripled to over 15,000. That ends up putting more pressure on long-term care because people can't live at home without assistance. The takeaway here, the population is aging and there just aren't enough options for people. It's an issue that has been building for decades, and it's coming to a head now, largely due to a lack of frontline staff. Today, Health Minister Sylvia Jones told the province's nursing colleges to move forward with regulatory changes that could help thousands of internationally trained nurses working in this province faster. Changes include temporarily registering the nurses while they become fully registered.